Hello, this is Dr. Hall. We continue with osteoarthritis and we are going to focus more on exercise. And here we're going to start with weight of work. It's like Hello, this is Dr. Hall. We're going to talk about osteoarthritis and we're going to focus on Hello, this is Dr. Hall. We're going to continue with osteoarthritis with more focus in exercise, and we're going to start with incorporate some kind of workouts in osteoarthritis, and one of them, the acronym is EMOM, is basically way of work with these people in Hello, this is Dr. Hall. We're going to talk about osteoarthritis and we're going to focus in more about exercise. We're going to start with an exercise program this time. Then is the acronym is EMOM, every minute on the minute. Is basically a program to work with people with osteoarthritis with cardiovascular and muscular endurance exercise, where you're going to choose different movements than people don't provoke pain. So basically you're going to warm up 5 to 10 minutes in light intensity. Then you're going to ask the client or choose different movements, 10 different movements, repeat it during a minute, and then when you finish that movement, rest a little bit and complete the exercise again. This is an exercise time modality that can be useful for people with osteoarthritis. Now we're going to present some guidelines for strength training with this population, and it's very important if people have osteoarthritis start in a low intensity in strength training. As you can see in the screen, you can start a lower level like 60% of 1 RM and do 10 to 15 repetition. It is important that the client don't feel pain before the exercise, and you identify over there which exercise are going to be convenient. Other important thing is if for some reason the person is complex to do some strength training exercise, you can try with other modalities like is isometric training, which gradually progress to dynamic and functional patterns. And it is important also that if you see some asymmetric muscles disbalance, try to work in that. If people has less strength in left left knee, you can work more in that area, part of your exercise program. Other important thing in here is that when you do exercise, strength training exercise with this population, the people do the range of motion and stay above the pain. The range of motion is very important, so sometimes they are not going to do a complete squat, they are going to do a partial squat. We're going to see in the next slides. And other important thing is that the movements must to be performed slow with a correct alignment, and it's important that the position of the client must to be correct in the fulcrum to do the exercise without biomechanical stress. There are other recommendations. Sometimes persons with osteoarthritis, it's complicated for them to grab some equipment. So it's important to use, for example, resistant bands with easy grab, medicine balls that can be carried with both hands or one hands. Use weight machines instead of free weights, for example. Or if you're going to add resistance, sometimes you can use wrist weights in the hands. Ergonomic is very important for the hands of these patients. Other important things about knee and hips, for this population is very important be strength in lateral way. So it's important focus work. For example, gluteus minimus, gluteus medius, to do lateral activities of daily living. Keep strong that area. For example, in here you can do another things than we can add in the training of this population is that sometimes the range of motion is going to be complex for them, and when we use a open chain non-weight training or closed chains weight bearing exercise, you can use it with not all the range of motion. For example, we have over here in the screen a picture with a full squat or a partial squat. So sometimes we are going to listen the pain of the client. Other thing is important to work the medial knee, the lateral knee, strength muscles like semitendinosus, strength muscles like vas lateralis. It is important in this case. We're going to present some exercise using body weight, free weights, bands or machines that are important to these persons, for these clients, and I'm going to put some videos in here. For example, I have here 6 exercises: lateral setups, camel's heels, knee extension, setups with heel taps, leg press, and also we have partial squats. This exercise can be used for these populations, are very easy to do, and we can combine this type of exercise. Another ones you can analyze it in here: Romanian deadlift, standing hip extension, sit to stand, side lying hip abduction, and side steps. Another 4: stability ball, wall squat, standing hip abduction, stationary lunges, and set ups. These exercises are highly recommended for these populations and are very easy to do it. Now we're going to present some recommendation for the knee of this person with osteoarthritis. For example, as we talked before in the last presentation, when you lose weight, you are going to have less stress in your knees. It's important you incline. If is overweight or obese, try to lose weight and keep strong the muscles than we talked before. Other important recommendation bad for hip is then sometimes exercising water, the range of motion can be a little bit more comfortable doing in the water. It's very recommended to do it this kind of exercise with people with located osteoarthritis in that part of the body. Other important area in the spine, we have some exercise to presenting here. The bridging, the prone plank, and the side plank is very important for this population. We had the bridging in here, prone plank, and side plank. It's important breathe correctly when you do it, and focus on the muscles of that area with a correct posture and neutral alignment. For flexibility, you can use, for example, PNF. We talked about PNF in the last presentation. We said that PNF is proprioceptive neuromuscular facilitation. You manipulate the joints of your client, and even you can use straps or bands. It's important to do it daily. The flexibility and mobility is very important for this population. Now we're presenting here some exercise then you can use with this person with osteoarthritis. We have the back stretch, cat camel stretch, child's pose stretch, and calf stretch. I want to present it in here. Back hip extension stretch, the first. Cat camel stretch. Child pose stretch. And the calf stretch. Very easy flexibility exercise. We have other more in here. Hamstring stretch in different position, hip flexor, hip rotation, knee to chest stretch, hip rotation stretch, posterior chest, trunk rotation stretch, and hand tendons glides. When you work with people with osteoarthritis, balance is important. It can be affected, and the most important thing in here is then they have a risk of falls. So when you exercise with them, and then your exercise design include ocular system, vestibular system, and proprioceptive system with your muscles, is even more beneficial. We have some exercise of balancing here: static balance, dynamic balance exercise, heel to walk, dynamic balance exercise, right beam, and dynamic balance exercise, tandem walk. Very easy exercise for balance training. Remember, falls can be a risk in this population, so balance is important. Other important thing in education for people with osteoarthritis is that they understand the condition, they understand the risk, the disorders, and how they can improve his strength and his physical fitness, and especially the risk of falls. Other important factor here in medication, remember, in this case the medication primarily is going to be for pain and and encourage the patient, if the patient is taking another medication that interferes with the exercise. For example, with the coordination, we must do you must do see the way, the hour, the more appropriate hour and effects to do exercise. Now, to finish, when to refer to a provider or physical therapist or healthcare provider. When the joint pain discomfort during exercise continue pain lasting 2 hours after exercise. That's one. The other one is when increased joint swelling, tightness immediately after or a day following an activity, decrease the range of motion, increase weakness, or altered gait after weight-bearing activities. That's the most important here in osteoarthritis, more focus in exercise.